Hello everybody, my name is Vince and my patient initials are DW. He is a male and Caucasian. His date of birth is 4/9/1960. That will make him a 66 years old. The patient presents in the clinic by himself and he is a reliable historian. Chief complaint, I have been coughing up phlegm for a week. HPI. DW, a 66 years old Caucasian male, presented in the clinic for a productive cough for a week, and the patient also complained of shortness of breath with activity, but he denied chest pain. He said that his cough up phlegm and the color is green. The cough is intermittent and it doesn't bother him at night. He stated that he take over-the-counter cough syrup and using Ceriva inhaler, but then they don't help him as much. The patient said that he normally needs albuterol inhaler or nebulizer as needed for the exacerbation, but he is out of medication. He usually has the exacerbation once or twice a year, and he is thinking that he's having the COPD exacerbation right now. Medication, so he takes Ceriva inhaler daily at home. He also uses albuterol inhaler or nebulizer as needed for his shortness of breath. And he takes losartan HCTG 50 mg over 12.5 mg PO daily for hypertension. Allergies. He has no known allergy to drug, food, or environment. Medical history. He has a history of hypertension and COPD. He has no surgical history. He has no recent or past hospitalization. He has no infectious disease. Smoking history. He used to smoke 10 cigarettes a day for 30 years, but he quit 6 months ago. Immunization is up to date. Family history. He has no significant family history. His parents passed away with a natural death and they didn't have any medical history when they were alive. Social history, he is retired and he is living with his wife. Diet and exercise. His diet contains fruits and vegetables and lean meats. He avoids eating canned food and fast food. He goes to the gym 4 times a week. Chemical history. He doesn't drink alcohol or using any illicit drugs. Review of system. In general, he denies fever and fatigue. HEENT. He denies headache, ear pain, eye pain, throat pain, or nasal drainage. Cardiovascular. He denies chest pain, palpitation, or edema. Respiratory. He reports shortness of breath with activity and a productive cough. Physical exam. Vital sign. Heart rate 90, respiration 22, blood pressure 126/79, oxygen 95% in room air, and the temperature is 98.9. He is 5'8" and weight 150. His BMI is 22.8, which is normal, and his vital signs are normal. The patient is not in acute distress and he is alert warranted time 4. Physical assessment on HEENT. The head is normal cephalic, eyes are symmetrical, no redness, no swelling, no jaundice, no drainage. Ears are symmetrical, no swelling, redness, or discharge. Tympanic membranes are visible without redness and swelling. The nose is midline, no septal deviation, no nasal drainage. The throat is pink and moist with no drainage, no lesions, no redness or swelling. Tonsils are visible, 2+ grade with no swelling or drainage. Cardiovascular, S1 and S2 are heard on auscultation, no heart murmur. Respiratory, no acute respiratory distress, no nasal flaring or rejections. Mild expiratory wheezes in bilateral lower lungs with no crackles. Differential diagnosis. Acute COPD exacerbation. So I think the patient has a history of COPD and he also has shortness of breath and wheezing. So I think his top diagnosis is COPD exacerbation. The second differential diagnosis is acute asthma exacerbation. So asthma exacerbation, the patient will have coughing, wheezing, and shortness of breath too. But asthma patient, they don't normally have productive cough. So I don't think he is having acute asthma exacerbation. And the next differential diagnosis is community-acquired pneumonia. Community-acquired pneumonia, the patient will have a productive cough, wheezing, shortness of breath, but they also have a fever and crackles. But then this patient doesn't have any fever or crackles. So I don't think he's having community-acquired pneumonia. So my final diagnosis will be COPD exacerbation. So diagnostic test, he will need a spirometry evaluation because he had a history of COPD, and he also needs a chest x-ray considering his age and his medical history. And he will need a low-dose CT scan for lung cancer screening if it's not done in the past year. The treatment, he will need albuterol nebulizer one time in the clinic, and then he will need a prescription of albuterol nebulizer solution or albuterol inhaler to go home with. Patient education, the patient should take the medication as directed. The patient should avoid exposure to smoke and other irritants. The patient should continue with the routine vaccination, so he's all good with his vaccination, which is good. And he always quit smoking. Yeah, so that is also a plus for him. The patient should go to the emergency room if his shortness of breath is getting worse or he's having fever, chest pain, and then he should go to the hospital. That is my presentation. Thank you so much for watching.